Yo, what's up guys? Hey, welcome back to the page. Welcome back to the X-Ray Zone. If y'all new here, go ahead and subscribe to the channel, man. You came to the right page. For any medical advice, whether you want to go for nursing or anything in the medical field, but especially if you want to get into the radiology field, because that's what I do. I've been doing this for over 10 years. I've worked in many places. If you kept up on my channel, now you know I'm a travel tech as well. So I've done it all and I'm doing it all, and I've honestly enjoyed my journey. So if you're interested in, topics like this, again, I got you. Yo, so today's video, I'm talking about, is it worth becoming a CT tech in 2025? Boom. Okay. So I'm gonna give you a few reasons why it is, all right? And if you stay to the end, the very last one is the most important one, all right? So I got a lot of backlash because I did a video on was it worth becoming a CT tech. I believe I did it probably 2 years ago. And if I find it, I'll put it right here. Because I made a lot of videos. But if it is, that'll be the video that, it was on. So the reason I made that video back then is because I was an X-ray, right? And, when I first started doing CT, I came from a small hospital. So I felt like I was like, oh, I can do CT, whatever. Because we did the normal, like the, scans without contrast. And then we did the scans but normal scans, like a brain with contrast, the abdomen, pelvis with contrast, a chest with contrast. The only CTAs we ever did was like a PE of the heart. Make sure you didn't have a, embolism and we didn't have to take you to surgery or well, not surgery at my hospital because it was small, or fly you out, right? So, back then, CT to me was scary because this is all I know. And that's the only thing I knew was a small hospital with just minimal CT. So what happened is like, I think I'm ready, to take my, skills to the next level. So I got a position at a bigger hospital, not a trauma center, but a bigger hospital. And dude, did they kick my butt, man. I didn't know anything of anything. I was so nervous, and I felt so to put it in perspective, I felt dumb, because it's like, man, I'm CT certified. And, I thought I knew this, but they do angios of the extremities. They do angio of the stomach. They do, perfusions of the brain for stroke. They did, CTA angio neck and brain. And you're like, what is that? I've never done that before. So it freaked me out. So I was honest on the video. I was like, look, man, CT is scary. CT is one of those modalities, man, that you really have to know your stuff, or you're just not considered a good tech, and you can only inject contrast one time within 24 hours. So you're like, man, if I miss this bolus, or if I don't do good on this CTA, PE study or whatever, then I'm gonna look crazy. The radiologist gonna call me and be like, hey man, what are you doing? Who you got over there, So yeah, so it was semi-negative, a video, but I was honest with you. I was honest with you from my experiences. On this channel, I tell you my experiences of what I, went through and what I'm going through. So yeah, I gave CT a little bit of a bad negative light, right? But now that I've been doing CT over a year, and now I'm traveling CT tech, man, the things that you learn and the confidence you build by just throwing yourself out there and just willing to learn and willing to be like, look, man, I'm here and I'm here to help you. Doing travel, I've learned so much and I'm grateful for it. And that's why I enjoy traveling, man. You know what I'm saying? I really do enjoy traveling. So look, man, here's the thing. So the first one is this. That's a big deal. As soon as you're done with radiology school, this is how short-staffed CT is. As soon as you get done, with RT program and you pass your registry and your RT, there's a 90% chance that most hospitals will be like, hey, you wanna train in CT? We're already seen you doing clinicals. We know you know how to do X-ray. We know you're good in the OR. You did 1.5 years of clinicals in X-ray already. We know you know your stuff. We need CT techs. Do you want to jump on? Do you want to come on and become a CT tech? And if you're scared, you're gonna say, nah, I'm not ready. But if you're that person that likes to get in and be like, hey man, whatever you want to show me, and I'm here. This is the thing you have to understand, guys, that free education is amazing education. If you don't have to go back to school to become a CT tech, and they can teach you in school, and they can teach you at the hospital you work at, why not take advantage of that? That's amazing. That's something that, most people don't have that ability, or they don't give them that chance. They have to go back to school. Like, for instance, here in Miami, we have this school. I don't live in Miami, but I live in Florida. That's the school I went to. And that school, you become a CT tech in 3 months, or if you choose to be an MRI tech, you can do that for 3 months. I'm not affiliated, but if you send them my link or send them, be like, hey man, X-rays on over there putting you on, you know what I'm saying? Hey, they might send me a sponsorship, you know what I'm saying? So hey, help your boy out. No, but in seriousness, yeah. So yeah, CT techs are so needed that's a benefit, man. That they're willing to cross train you right away. Like, that's super awesome to me. The second thing is this. I mentioned it before, and I get, if you're not a CT tech, you really don't understand. But it's so nice whenever you have a transporter, for the most part, to bring you your patients, and all you had to do is just scan. That makes your job that much easier, because in smaller hospitals, you have to go and get your patients, and you have to go get your patients. Not that it's hard, right? But it's like, man, I gotta get my patients, bring them on, slide them by myself, and then scan. Like, that takes a toll after a while, you know what I mean? Even you get big patients, small patients, you get your walkie-talkies, were always awesome. But for the most part, people go to the hospital because they're sick. So if you have to go get your own patients, that's hard, man, because you get these 300-pound patients, or sometimes you get these patients that are 150, but they're dead weight and they don't help you. You're like, oh man, now you gotta like pull and struggle. It's a lot out there, man. It's a lot to think about out there, whenever you don't have transporters. But when you have one, man, you're so grateful. You're like, hey man, thank you for getting my patient. I appreciate you, and thank you. So if you have a transporter out there, man, you better show them love and show them some respect, man, because they do a hard job, especially when they get into inpatients. Oh, those inpatient beds are so bulky, and they're so hard to go through the elevator, and then you get stuck in, that's my anxiety, right? Getting stuck in the elevator. I've done it before. It happened to me before, and that scared me, dude. And I was like, But yeah, man. So you get a transport, you get people, bringing your patients. That's super dope, in my opinion, man. So that's a plus. The third one is this. Yeah, man. It comes with better pay. You got to think about it, right? So now you're kind of like you're taking that next step to your career. So in radiology, for as far as general X-ray, you don't have to worry about starting IVs. You really don't have to worry about injecting anybody with any kind of contrast that can hurt their kidneys or possibly put them into shock. So it's a big responsibility you're taking. We don't just do CTs and be like, oh yeah, we inject them, whatever it is, what it is. Like, no, you're responsible now. So if they order a CT scan with iodine contrast, you go like, hey, have you had it before? Are you allergic? Are you pregnant? That's a really important one, man. If they're a certain age, I think most hospitals are like between 12 years old to 50 years old. I know 12, it sucks, man. I can't believe there's people out there, that's 12 years old that can possibly be pregnant, and it's a sad world out there. And I have a little girl, man. I pray that never happens, even though she's past 12. But it's like, it's a lot. I know it's off the subject, but I'm just saying, you have to be from 12 to 50. You have to check, make sure you're not pregnant, because then that falls on you. If you didn't ask the question, or if you seen that they ordered a adenine pelvis and she's 32, and you scan, it's happened before, you scan the patient and you see an embryo in there. You're like, oh, what did I just do? Thank God it's never happened to me, and I pray it never happens to me. That's why whenever you bring a patient that's pregnant or possibly pregnant, there's always a form in the CT department that tells you, is there a possibility to be pregnant? But like, no, I ain't pregnant, boy. So they like, you sign it, and okay, they go. They signed it, they dated it, it is what it is, and they're done. It's kind of out of your hands now, But you still want to be considerate as a healthcare provider, and you don't want to give radiation to possibly an embryo in the stomach, and you don't want to cause any kind of side effects to the baby. So do your due diligence, man. Make sure that they're not pregnant and all that good stuff. So more of the story is that you do have a lot more responsibility that you have to deal with when you go into CT. Not to scare you, but because if you have a good mentor in CT and they're gonna train you, they should sit with you for at least the first 3 to 6 months. Sounds like a lot, but they should sit with you the first 3 to 6 months and make sure that you understand what you're doing. If issues happen, if you cut the anatomy off, how do you fix it? If there's multiple exams to be done at once, how do you do them? How do you split them? If there's an angio to be done, where do you put the ROI? How much contrast to give? All these are valid questions and all these are important things to know, and your mentor in CT should be teaching you this, okay? So that's the thing, right? So the last one to me is super, super important is this. Yes, so many job openings out there, so many big bonuses that they're giving away now. And it's not giving away, you know, you're gonna work for it for the most part. But when you go to school, that's the most important thing. You know, oh, I want to go to school, you know, but then a lot of people don't do their research and be like, oh, I'm going to school I'm just doing, not to throw anybody's career under the bus, because any education is amazing, right? But just throwing it out there like an archaeologist. Like, I never looked it up, and I'm not sure how many jobs are out there. I only know the medical field, but I'm sure if you look up archaeologists and you look up CT techs, I'm sure there's probably more CT tech jobs than there is archaeologist jobs. And I can be wrong, and if I am, forgive me. But you want to when you go to school, you want to make sure that there's plenty of jobs out there, man, because the last thing you want to do is go to school, bust your butt for 2-3 years, and then when you get out, you're struggling to get a job. Like, man, that's it's heartbreaking, you know? So yes, more of the story, CT tech, it is worth it to become a CT tech in 2025 and beyond. And if you're able to get into something else, MRI, if you want to do ultrasound, whatever, any free education is great education, even if it's not for free. If you love the radiology field, continue growing and doing what you love. So hey guys, if you stay to the